WHO office in Athens, in Greece, then I would try to provide an answer why we should have a Southern European health model and a Southern European health perspective. And then I will finish with a Greek global health strategy. Starting from the first point of the EU Global Health Strategy on November 30th, 2022. It has been launched from the European Commission, this strategy, and then it brings together three major points. The first one is better health and well-being, and the main question is how well do we really measure health and well-being? The second one is strengthening health systems efficiency and effectiveness that we will discuss. And the third one is combating the health threats. This is the EU Global Health Strategy, and these are the 20 indicators that they really discuss and mention about this. I would like to concentrate on number 14, which is the number 14 indicators highlight the collaboration with the WHO and in terms of strengthening and investigating the leadership, the effectiveness, and the efficiency of the healthcare models. And then what it says is that the European member states should impose some sort of measures on accountability, and then we should establish a closer collaboration among these initiatives. Now, I would like to draw your attention to a very recent publication by WHO Athens, which is entitled Taking the Pulse of Quality of Care and Patient Safety in the WHO region. And then this report is based on a cross-sectional analysis. It is analyzed 53 member states, a survey that was launched in 53 member states. And then it's focused actually and provides evidence on 46 indicators. And on the base of these 46 indicators, the major conclusions are the following, that there are critical gaps in the efficiency and the strengthening of the healthcare systems, as well as limited implementation of national action plans among the member states. And the interesting thing is that this report focuses on effectiveness, efficiency, people-centeredness, safety, equity, and access. An emphasis is using to the measurement of population health outcomes and quality indicators that we will discuss in a short while. The second part of my presentation is why we should focus on a Southern European model. Well, we learned yesterday from Maria that the Southern European model differentiates, first of all, includes Italy, Spain, Portugal, and Greece, and differentiates from the rest of the European countries. The interesting thing, Maria presented us yesterday a SWOT analysis. It's a good idea, actually, to apply this SWOT analysis, which is based on internal and external consideration. The internals are the strength and weakness in the Southern European model, and the external are the opportunities and threats that they have to develop in collaboration of the joint action. Well, I wouldn't like to go in details, but the universalistic principle, the strong role of the family, which is very, very important in the Southern European countries, despite the lack of a good organization of our welfare and the healthcare systems, emphasis on hospital care, and then these are the fourth countries that they got very much through the pandemic, and they confronted lots and lots of problems, but it has been a post-COVID recovery in terms of the crisis. The weakness is underfunding, that we will discuss it, fragmentation of the healthcare system, health inequalities that has been discussed extensively, and we will provide some references, out-of-pocket payments and catastrophic expenditures. Opportunities is a better opportunity to collaborate with the joint actions and see to what extent the Southern European model fits into the joint actions for a global health impact, digital transformation, prevention and health promotion, as well as closer collaboration with the EU countries. Now, let me present some indicative results from the analysis of the indicators in the Southern European countries that are based in the report by WHO. Here, what you can see is Greece, Portugal, Italy, and Spain. And then in these national action plans, what we can really see, the green is for great success. The yellow one is for progress, and the red one is for failures. So we can see that Portugal and Spain is doing quite well. Greece is a bit the most problematic country, and Italy is doing quite well, but they haven't provided that many information to the European and the WHO strategy. And coming to the population analysis, what we really focus here is a dynamic perspective. And in this dynamic perspective is thanks to the World Bank and all these indicators that we analyze. And these indicators are incorporated into the so-called country profiles. Here is, we have Portugal, the brown one is the EU average. And what we can see is that all the European countries, all the 4 Southern European countries enjoy a much higher life expectancy. If we go though into the funding of the healthcare system, we will distinguish into our analysis 4 periods: before the crisis, the economic crisis, the pandemic, and the post-pandemic. And then we can see, in comparison to the EU average, all these 4 Southern European countries confronting an underfunding. In terms of public underfunding, we can see that the gap is much more significant, with Portugal and Greece being among the countries with lowest. Different sort of dynamic scenarios in terms of convergence or divergence. But again, it would be a very good idea to analyze before crisis, economic crisis, the pandemic, and the post-pandemic. And then comparing the public health expenditure on the vertical axis with individual reported quality of life, we can see that all these countries come together, where is Italy, Portugal, Greece, Spain, and Poland, actually, where we can see these are the countries with low health expenditures, and because of the low health expenditures, they have a low quality of life. Quality of life has been measured by some sort of specific measures that, and is a composite indicator. And now I will come to the third part, which is the global health strategy increase. How we will try to improve this. The sort of conceptual model is we will have a very close collaboration with a joint action to launch the Greek health strategy. The outputs will be a Greek health report where we will use the 16 indicators by France and Germany and other countries. And then the impact, we will make some analysis on the long-term impacts and the long-term effects. With the outcomes, we will have a close collaboration with WHO office in Athens, and then the activities, several publications and webinars. From a methodological perspective, we will have 2 parts. The first part will be a profile of the country, and then again we will have a dynamic analysis, an analysis of economic crisis, the pandemic, the post-pandemic, and the forecasting of future. We will analyze the epidemiological cycle with economic cycles, and then improving the clustering of different countries and the development of the 16 indicators that we mentioned before. Now, presenting actually a first glance of how we're going to do this. This is the top line is the EU average, and the Greek line is the top one, and the other one is the EU average. And in terms of health, in terms of the economy, the GDP per capita, the top line is the EU, and the lower line is the Greek one. So what we can say is, in Greece, we enjoy a very high level of well-being and life expectancy, but we have confronted a tremendous divergence from the EU average. So what we really do is we compare the economic cycle with the epidemiological cycle. And coming towards the end, the key Greek priority areas will be addressing health inequalities, digitalization, workforce, access to medicine, pandemic, surveillance, One Health approach, strengthening, as we mentioned, the collaboration with WHO, and enhancing the EU role. And Oop. And in terms of the Greek strategy, we will focus on the governance, analyzing the EU health governance, collaboration with WHO, closer collaboration with joint action and EU global health strategy. Emphasis will be given on dynamic aspects of well-being and quality of life. And we will really try to initiate global health research in collaboration with joint action and the different countries. Sorry, thank you very much indeed. These are some indicative publications that we have really published in international journals. I'll be delighted to provide any answers. And I'm right on time, Madam Chair. Huh?
Oh, you are perfectly in time, John. I think we are under impressed, really. It was so quick and so full of informations. Do we have any questions for John? And the same question goes to the online participants. Yes, Jerome?
Yeah, John, this is the old question on the difference between a national health strategy and a national global health strategy. Well, in France, we have both, and the texts are quite different. In your case, in Greece, because you show also the margin for progress, you're both a beneficiary from global health strategies, including WHO action to and EU colleagues' action to partner with you and to strengthen the Greek health system. But do you believe that a national health strategy is a global health strategy, where global health strategy are more related to how you as Greek country could help other countries or could develop bilateral agreements in the field of health with African countries or countries from Latin America, for instance. In your mind, what's the distinction between both?
Right. Thank you very much indeed. Because the Greek report would incorporate two components. The first one would be the country profile, where it would be a comparative perspective of Greece in relation to Southern European countries and the other, as I presented. And the second part would be the 16 indicators that would be provided by the EU Global Health Strategy. And then we will undertake two things there. The first thing is that we will present how Greece compares to the rest of the EU countries with these EU global health indicators, the 16 that we mentioned before. And then what we will try to do is we will further develop, I haven't mentioned here, but we will develop some sort of cluster analysis to investigate on a quantitative terms to what extent Greece clusters together. I think in our own expectation is that Greece does not cluster together very well with a central, with the southern European countries, but is becoming much, much closer to Central Eastern European countries. So, which is Romania, Bulgaria, Hungary. And then it would be very interesting to see all these taxonomies that have been discussed before, that in a dynamic perspective, they really change. So from a global health perspective, and from the European perspective, the idiosyncrasies in terms of clustering the countries will be very interesting to see how they combine together. So using all these 16 indicators and developing some sort of cluster analysis, classical cluster analysis, I don't want to go to technicalities, that will be in the report. And then and also we'll use a stakeholder analysis where all these countries will come together. Anyway, I don't want to go to the technicalities, but on the quantitative side, we will analyze the 16 indicators developed by the different countries, Germany, France, and other countries that would probably provide these indicators. And on the base of these indicators, we will analyze the Greek perspective. Thank you very much for the question. I think that I provided an answer to.
Extremely relevant, because I think that we have these national health strategies and then we have this global health, the global health strategy. To what extent are they actually overlapping? So to what extent our health systems actually have the same needs, same requirements? That's a very interesting question, although I don't think but we can think about them being totally overlapped. But there are certain elements which we could share. For example, if I look at my country, Finland, which is thought to be quite, how should I say, developed in terms of the health systems and its functioning. Still, when we looked at the essential primary healthcare functions or public healthcare functions in our country, we found that we are far from perfect in many respects. So we can also learn from this type of approaches. Thank you.
Yeah, I fully agree actually that we should have a national strategy highlighting in the report the idiosyncrasies and the characteristics of different countries. But then emphasis should be given to the EU global health strategy, where we will provide in a comparative quantitative sense, in a comparative analysis, we will provide the relative characteristic, the relative pros and cons in different indicators that would be analyzed by different countries. So that will be a comprehensive methodology with comprehensive results and very good proposals for governance and for future perspectives and policies with regard to a holistic approach to health, as well as with regard to specific like health inequalities, primary health care, hospital care, and so forth.